Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about chronic lymphocytic leukemia. In particular, I will cover what is chronic lymphocytic leukemia, how you treat chronic lymphocytic leukemia, and how you can better live with chronic lymphocytic leukemia. So to start, what is CLL, or chronic lymphocytic leukemia? So CLL is a type of cancer of the blood and bone marrow, the spongy tissue inside bones where blood cells are made. The term chronic in chronic lymphocytic leukemia comes from the fact that it typically progresses more slowly than other types of leukemia. The lymphocytic in the name chronic lymphocytic leukemia refers to the cells affected by the disease, a group of white blood cells called lymphocytes, which help your body fight infection. In leukemia, the cancer causes more white blood cells to be produced than are needed. Over time, these cancerous white blood cells build up, disrupting the normal balance of cells in the blood. This means that the body does not have enough red blood cells or platelets. This can cause symptoms of anemia, such as tiredness, making you prone to excessive bleeding. And also, because the white blood cells are not properly formed, they are less effective in fighting bacteria and viruses, which means that you're more vulnerable to infection. In its initial stages, CLL usually causes no noticeable symptoms. The symptoms of CLL include having repeated infections in a short space of time, tiredness, breathlessness, weakness, night sweats, unusual bleeding and bruising, swollen spleen, and swollen lymph nodes. The presence of swollen lymph nodes provides a useful way of tracking the progress of CLL. This is because as the number of lymphocytes increase, they begin to collect in your lymph nodes, which are part of your lymphatic system. The lymphatic system is a series of glands or nodes that are spread throughout your body in a similar way to your blood circulation system. These glands produce many of the specialized cells needed by your immune system. Having 3 or more swollen lymph nodes may mean that your CLL has progressed to a later stage, and treatment may be required. Doctors aren't certain what starts the process that causes CLL. Doctors know that something happens in order to cause a genetic mutation in the DNA of blood-producing cells. Beyond being ineffective, these abnormal lymphocytes continue to live when other cells would die. The abnormal lymphocytes begin accumulating in the blood and certain organs, where they cause complications. They may crowd healthy cells out of the bone marrow and interfere with normal blood cell production. Factors that may increase the risk of chronic lymphocytic leukemia include your age. So most people diagnosed with CLL are over 50. And your sex. Men are more likely than women to develop CLL. And your race. Whites are more likely to develop CLL than people of other races. And also family history of blood and bone marrow cancers. A family history of CLL or other blood and bone marrow cancer may increase your risk. And also exposure to chemicals. Certain herbicides and insecticides have been linked to an increased risk of CLL. So next is, how do you treat CLL? Your treatment options for CLL depend on several factors, such as the stage of your cancer, whether you're experiencing signs and symptoms, and your overall health and your preferences. People with early stage chronic CLL typically don't receive treatment. Studies have shown that early treatment doesn't extend lives for people with early stage CLL. Rather than put you through the potential side effects and complications of treatment before you need it, doctors carefully monitor your condition and reserve treatment for when your leukemia progresses. About 1 out of every 3 people who have CLL diagnosed at the earliest stages will never need treatment. There are several factors that you will need to take into account when deciding on your treatment, and they include your age, the likely progression of your cancer, the extent of the cancer, and the possible side effects of treatment. So there is no current effective medical treatment for early stage CLL. So next is considering chemotherapy. Once CLL progressed to a more advanced stage, the treatment option is chemotherapy. There's also monoclonal antibody therapy. So monoclonal antibodies are antibodies that are genetically engineered in a laboratory. They are designed to directly target and attack cancer cells. And this is why monoclonal antibody therapy is sometimes referred to as targeted therapy. And also there's bone marrow and stem cell transplantation. The only available cure for CLL is to receive bone marrow or stem cells stem cell transplantation. And finally, how do you live with CLL? So you can take steps to keep your body healthy if you've been diagnosed with CLL. So try to do what you can to avoid infections. People with CLL are prone to frequent infections, so take steps to keep yourself healthy. Eat a healthy diet and plenty of fruit and vegetables. Get enough sleep so that you wake feeling rested. Next, reduce your risk of second cancers. People with CLL have a risk of second cancers. Lifestyle changes may help reduce your risk, such as not smoking or not drinking alcohol, and eating a healthy plant-based diet and using sunscreen when you're outside. Next, go to all your appointments. Frequent blood tests to see if your cancer progressed can wear you out. Each time you go for your test, you may experience anxiety that your cancer is worsening. Don't let this stop you from going to all your appointments. Instead, expect that you'll have some fear and plan for it. And finally, before I finish, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing CLL more effectively. To start with, we have numerous products to get you set up and started on a gentle exercise program, such as exercise ball, floor mats, and various other necessary equipment required to get you started on a program tailored for you. But first, you get advice from your doctor or consultant before you start any exercise programs. We also have various items which you can purchase from us, such as a light box, blood pressure monitor, and lavender oil for relaxing. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing CLL with confidence. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.